Good evening everybody. Elrigu namaskara. This is Gayatri Devi working in Kolors Healthcare, Namma Karnataka Rajyadalli and Namma Bengaluru Nagaradalli. So today is live all about your weight loss masterclass. Yes. Now we are living in a time where food has become so confusing. Every day there is a new rule, new miracle ingredient and new diet. So, and in a noise where we have forgotten something so simple. Yes, there is no one to break it down better than Kolors Healthcare. Yes, Kolors Healthcare has everything to make you feel energized, balanced and stay healthy. So Kolors is basically committed and scientific driven and taking back control your weight loss journey. Yes, I'm going to talk about today in this weight loss masterclass about how to lose weight. In a longevity perspective, I would like to tell you all how to maintain the weight in a long term and how to burn the fat efficiently and how to lose weight. Now, I have a question for you all. So let me ask you a question. What is mother of all diseases? And now you have an answer. Cancers and heart diseases. But according to doctors, the mother of all diseases, obesity, the global health epidemic. So obesity basically poses threat of early death and cognitive decline, all hormonal disruptions, and most importantly, the visceral adipose tissue, the most hyped fatty liver. So there are vital organs in our body like kidney, liver, heart, intestine, pancreas. Every vital organ will have a protective fatty tissue. But then the more fat cells accumulation in our body, there is no detoxification done by the liver and kidney. Those two overloaded organs, liver and kidney, cannot do the detoxification process. That's when usually this liver pumps out the inflammatory chemicals, which is IL-6 and TNF-A, where because of this there is arterial stiffness and this is basically damaging the heart and arteries. And most importantly, most of the cosmopolitan cities, people are suffering from male fertility and female fertility issues, hormonal disruptions like thyroid, PCOS, PCOD, and PCOS cannot be treated. It is something, a metabolic disorder we are carrying in our metabolic system, right? So that is one thing. And obstructive sleep apnea, insomnia, the cortisol is literally boiling down the body and body's metabolism. So these are all obesity intra-related medical complications. And one should understand obesity doesn't come from, the hospitals, because this is not just a disorder. The obesity is lifestyle disease where it doesn't come from the hospital. It basically comes from the broken metabolism. So before getting into that, so let me, there are so many people are joining. So I would like to go through it quickly and then come back to you guys. If anybody would like to ask any questions, please do ask me. So in Kolors, in our day-to-day practice, we have been encountering many patients. Uma, hi, and Sudha Chowdhury, Manigandan. So, hi everybody. So, BP Sharma, hi, thanks for joining. So, coming back to the question. So, in Kolors, like every day in our practice, and especially I myself encounter many patients. Nowadays, most of the people, they started doing a trendy diet, which is a calorie deficit diet. So the many people, the moment quickly, they get that thought, we wanted to lose weight. And everybody's 2026 New Year's resolution is to lose weight. And by now, almost 1 month down we are. So most of the people might have started. But during this process, everybody is making the grave mistake. The monster is the calorie deficit diet. So anybody wanted to lose the weight, immediately they get enroll themselves in the gym membership and they do lot of intense workouts, and then they'll cut down on the sugars, they'll cut down on the carbohydrates, everything, and instantly they lose weight. But after some time, within 2-3 weeks, and slowly they see some kind of energy loss, and they leave the physical activity, and slowly they are falling back into their old habits, like eating a lot, and then they'll become emotional binge eaters and all. So I'll tell you an example. In my practice, a 30 years IT woman comes to us. We usually take like clients' history, the medical history and lifestyle history, how they put on weight, and then how they're suffering from this obesity. So during this, everybody has one common mistake, and everybody has done one common mistake doing the calorie deficit diet. The calorie deficit diet, something, it depends, most of the people, they take only 800 to 1200 calories. But then whether it suits their body or not, most of the people doesn't know. They're not even aware of it. That 32 years of IT woman, when she'll start this calorie deficit diet where she's consuming only 800 to 1200 calories of food, so initially like 2-3 kgs she'll be losing, and she'll be very happy, she'll be getting the compliments, and within no time, in 2-3 weeks, her dresses will become so loose, and she'll become from large to medium, her clothes will become. And after some time, after 2-3 weeks, and slowly she notices some kind of changes. The changes are nothing but energy loss. Once she's seeing the energy loss, that's when the physical activities, whatever she is to do, that will be stopped abruptly, and then she'll be having a lot of mood swings, and she'll be getting angry, she'll be having irritable bowel syndrome, and some kind of disruptions in her menstrual cycles, and she'll not be getting sleep properly. Lot of her circadian rhythm also will get disturbed. So the many changes, and then acne breakouts, and then many changes, getting angry, and she'll become emotional binge eater, and she'll be putting on weight what she used to before. More than that, she'll be putting on weight. So when they're doing all these things, one should understand the body also has a biological process. The body itself sets, there is a biological mechanism which is called as adaptive thermogenesis. Yes, this is the body's survival response. So when they're doing all these calorie deficit diets and all, most importantly, there are two hormones. One is ghrelin and leptin. So the ghrelin is the hunger hormone, and leptin is like the energy imbalance hormone. So when they're suffering from these two hormones, ghrelin will increase rapidly, where they feel hungry, and the appetite levels will increase rapidly. And whereas leptin, it decreases rapidly, where usually lot of changes in their energy. So when they do not have energy, they'll not have any kind of time to do any kind of physical activity. They'll not have that energy to do any kind of physical activity. So this entire process, something is happened due to these two hormones, so called ghrelin and leptin. And this is again when the body is going through something, all of a sudden the body doesn't know basically it is doing the diet. The body knows that there is something is happening to the body. That's when this adaptive thermogenesis plays a very safe role. Basically, this adaptive thermogenesis is body's saving method. It is body's biological mechanism system, and naturally prepared by the body itself. During this time, the body goes into the energy saving mode. So that's when, instead of losing weight, most of the people within 2-3 weeks, they'll start gaining weight. And rapidly they'll increase the weight, right from overweight to grade 1 obesity, grade 2 obesity, and they'll become morbid and then chronic obesity. So just because of this one mistake, calorie deficit, one should understand here the motivation is not the matter. The method, what she's choosing, the path, what she's choosing is the matter at the end of the day. Because the harder you push the fat, the harder your body resists. So the calorie deficit diet doesn't work all the time. This is something literally boils down the stress hormones, boils down the ghrelin and leptin hormones, and then that's when the adaptive thermogenesis will be activated, where the body in response to lose weight, the body goes into the energy saving mode, That's when instead of losing weight, and people usually they put on weight. This is something the body also has a biological mechanism system where it doesn't work out according to our wish. We have to go as per the system. We have to go as per the body's condition. There are certain kind of criteria we need to meet, right? From age criteria, there is body metabolic rate, and there's a lifestyle, and the circadian rhythm, the sleeping pattern, and right from the medical complications. There are many criteria one should take into consideration. So losing weight, having said that, it is not as easy as magic pills or faster scanners or operations. It is pretty difficult to lose weight. So one should understand, one should approach, there is a right technology, right doctor, and right method to follow to lose the weight. Because in my practice, whosoever I have been encountering, everybody once in their lifetime, they do this calorie deficit diet and they'll become victims for this weight gain for the lifetime. So now, again, getting back to the questions. So let me ask, a couple of questions. Let me answer. Guys, please do ask me some questions, and most of the people I'm seeing like they're joining but they're not asking me any kind of questions. Please do ask some kind of questions. Okay, well, getting back to the topic. So the how Kolors is going to help out these people, like whosoever is suffering from overweight and grade 1 obesity, grade 2 obesity, morbid obesity, and chronic obesity. So the basically Kolors, we have a synergetic approach. The synergetic approach is nothing but just an energy based devices and then lifestyle modifications. This basically energy based devices, it works by sound energy and then heat energy, doesn't harm any kind of a body's bone or muscle or like any kind of the blood vessels, surrounding tissues. Nothing can be intact. So absolutely there's no side effects, and these treatments will be done under supervision of certified doctors, certified nutritionists, and there is a multidisciplinary team who is working accordingly. And usually in Kolors, we start with lifestyle modifications. The lifestyle modifications, it's nothing but eat on time and sleep on time, and try to maximum avoid junk food. Out of 7 days, 5 days, they can stop having cravings of junk food, and then rest of the 2 days they can have a cheat meal. So we are not into any kind of paleo, keto, or GM diet or intermittent fasting diets. We are not into such kind of diets. So in the beginning of the live, I have told you all. So in a longevity perspective, I will tell you how to burn the fat efficiently and how to maintain the weight in a long term. Basically the Kolors motive is, we are not just looking for short term weight loss treatments to give the clients. We are looking for in a long term. We ensure the people are not gaining the weight in a longer term. Once they lose, we ensure they're not bouncing back their weight, because when people approach us, most importantly, they're not only investing the money, they're investing the time. The time is money. The time is very precious in today's world, in today's generation. So we ensure, the people are not bouncing back even in a long term. So this is the Kolors, synergetic approach treatment for the weight loss. Those are suffering from overweight to the grade 1, grade 2 obesity. So this is all about calorie deficit diet. So having said that, lifestyle diseases doesn't start from the hospitals, it starts from the broken metabolism. So ensure before you're gonna start any kind of calorie deficit diets and then intensive workouts, and then you think twice, doing all these things, because the body, the body is the only thing where you cannot sell, upgrade and trade. Your body is like a home. So one should understand. How to lose weight? Hi, Veena Jeremiah. So how to lose weight in 1 month? Please suggest me, ma'am. So you can lose weight. So there is lifestyle modifications. Along with that, you need to come down to Kolors for that consultation. The consultation will be given by certified doctors and certified nutritionists, and then our wellness consultants are there to help you out. So it depends upon. So there is a body composition analysis will be done. And now we have Kolors 2.0. We have been upgraded. That is all about new infrastructure and new, everything is new, and technology wise we are upgraded. So even the BCM machine what we are using is HPod. It is not like the basic general BCM machine. So where we get to know how many calories you need to consume, and then what is your the body's biological mechanism system, what is your body metabolic rate, what is your visceral fat. How to my wellness consultants will tell you how to lose weight, but absolutely there is no side effects. Having said that, no injections and no kind of any. So now one of my favorite topics, I'm going to talk about it: semaglutide injections. Semaglutide injections, favorite topics. Basically the semaglutide injections have These semaglutide injections have taken quickly mainstream, and nobody is talking about its side effects. So what is semaglutide injections? And right from celebrities to common people across the world going gaga over the semaglutide injections. Basically the semaglutide injections, so-called GLP-1 injections, by slowing down the digestive process in the body and suppressing your appetite. This is how the semaglutide injections works. And there is GLP-1 hormones, that basically these GLP-1 hormones will be mimicked by the semaglutide injections. And yes, most of the people are using these injections, and then one must be very, very careful. Because without physician's consent, they're just going to a pharmacies, and then they're getting it done, and they're just buying. In market there are many diluted products, and there are many grey products, so one should be very, very careful. So when talking about this GLP-1 injections, recently there's an Ozempic, Wegovy and Mounjaro, there is a Victoza, Saxenda. There are many semaglutide injections, and I would like to tell you all one thing. As per recent analysis, and whosoever patients have taken the semaglutide injections have lost about on an average 6.3% of their body weight. Yes, on the surface that looks so successful, but the problem is what else was lost in the process that matters, right? So without intake of protein, many women, especially older women, they have lost the massive amounts of muscle. So the muscle is everything. The muscle is essential part of our body. The muscle, it is very crucial to supporting the metabolism and protects the bones, and also the regulating the hormones and stabilizing the blood glucose levels, and also that keeps the body functional all the time. So the muscle is very, very important to our body. So imagine when somebody is losing the weight, it's just not 20-30 pounds of weight when they're losing. When they're losing the muscle, it is not just the weight they're losing. They're literally, age their body almost by a decade or more. So before celebrating the rapid weight loss, there is a question to ask, right? So there is a bigger question to ask, because the semaglutide injections, most of the people suffering from thyroid cancers, and basically this weight loss is not coming from the fat. This is basically, it is scientifically proven, the weight loss is coming from the lean mass. So that is one should realize. And before administrating and before opting for the semaglutide injections, each and every person should understand, without enough protein and without micronutrients, when the body is losing the muscle, just as quickly as the body losing the fat. So as simple as that. So the muscle, when the muscle is protected, right from your hormones, and then so-called that metabolism markers, right from your digestive system, right from your metabolic pathway and your immunoresponses, your enzymatic system, your detoxification system. So everything naturally improves as well. So one should understand, in a long term, health depends on preserving the muscle tissue that keeps the body strong, resilient and mobile for life, not to opt for this quick fixes to lose weight. Because once we lose the muscle, we are literally losing the entire body metabolic process, right? Because right from nothing can be working properly in our body, because the entire body's mechanism is literally relying on the muscle. Having said that, in a longevity perspective, muscle plays a very crucial role. It is very important. Even in Kolors, if anybody opts for the weight loss treatment, along with that we ensure they're getting proper muscle strengthening treatment, for which we have one game changer technology, which is an EvolveX. That is something a very innovative and a very a structural and synergetic therapy, what usually we offer to our clients, to increase the muscle. So for us in Kolors, we, having said that, we do focus on fat loss, at the same time we do focus on muscle. So both the things we ensure it will be taken care. So let me come back to the questions. I would request everybody to ask me some kind of questions, and most of the people, I can see they are joining the live, but hardly they're asking me any kind of questions. I would love to answer any kind of questions related to wellness, related to weight loss, related to skin, and related to hair. Please do ask me some kind of question, guys. And today's weekend, everybody is interested to listen the live, and nobody is interested to ask me any kind of questions. So, okay, let me come back to my, the topic and wellness topic. Oh, thank you. Somebody like Sam, how muscle is improved with the treatment? What equipments will be used to improve muscle in Kolors? Yes, well, having said that, there is a so-called innovative treatment, EvolveX, and other innovative treatment. We do have Firmus. We usually release, the EvolveX is something, it is an energy-based device and very high energy-based device. So it is literally competing with high-intensity focused ultrasounds, which we usually use in aesthetic medicine, right? So we release involuntary muscle contractions into the body, where the muscle is supposed to respond to these contractions, and these contractions are stronger than the normal natural contractions. In the gym usually we do a lot of crunches, some 10-20 crunches we do, right? So this EvolveX is 100-200 times stronger than these natural contractions, due to which, because of this muscle, since it is being forced to respond, naturally the muscle improves in the body because of the energy based devices. And where, once the muscle increased, and whatever the food they consume, that will be converted into energy, that will not be converted into fat. So that is one of the technologies. And then we do use Firmus. Firmus is something where we usually do stimulative therapy for the muscle. So it is kind of a passive activity where the muscle will be like activated naturally. The muscle itself will increase naturally because of the stimulations what we release into the body. That is one of other method, which is called as a Firmus. Will this contractions affects organ system? No, absolutely, Mrs. Samina Khanum. This doesn't affect, the other organs of the body like kidney, liver, heart, intestine, pancreas. No, absolutely no. Because there's a muscle, there's a bone, and there is like surrounding tissues, and everything is there. The deeper tissues, we don't, these energy-based devices will not get into it. And also the manufacturing of the machine such a way, it is basically like, can only targeting this muscle and, the adipose tissue and the subcutaneous tissue. But there is no other internal organs will not be impacted. It will not be affected. So don't worry about it. You're welcome, Mrs. Samina Khanum. So anyways, again, come back to the, oh, Grishma. How long does it take to see visible results? It depends upon your body metabolic rate. It depends upon your, how much weight you need to lose. So on an average, if you're a healthy person, you can lose around 4 to 5 kgs. If you're not a healthy person, for example, if you're having any kind of hormonal imbalance like thyroid, PCOS, PCOD, or diabetes, so such people can lose around 2-3 kgs in a month. Again, it depends upon the technology. If you're opting for the premium, the proper scientific driven technologies, you may lose even 6 to 7 kgs in a month. And but always remember, something, if somebody wanted to lose weight, it is not something, there is no way to shortcut health without your body paying the price. So you need to come to that treatment on regular basis, at least weekly, once, twice. You should be in a position to visit Kolors. And then every session there is a decent weight loss, half kg to 1 kg. And then our dietitians will help you to how to maintain the weight. So this is a proper system where it has to be followed religiously. And we ensure your regular regime and your present lifestyle without disturbing your present lifestyle, without disturbing your regular regime. So Kolors usually will offer the customized weight loss treatments to our clients. Sona, if in case our body didn't respond, will you give the refund? So see, on this platform, I should not talk about this refund policies and all, because that is that will be taken care by the management. I don't know how the Kolors policies and then terms and conditions. So I'm not going to address this issue on this platform. So thank you so much. Sudha, is a program overseen by a doctor or certified health professional? Yes, right from the beginning of my life. I'm telling you guys, there is a multidisciplinary team is involved, and we do have an R&D department who is exclusively taking care of, each and every client's weight loss treatments. And then we do have a proper certified doctors who is MBBS MD, not like Ayurvedic and homeopathy, and certified nutritionist, and they are from proper well-renowned universities, and paramedical team, and we do have physios on board. So everything will be monitored by proper multidisciplinary team. What is the ideal metabolic rate for a 32-year-old woman? So the ideal metabolic rate depends upon your age and height. So for that, you need to come down to the branch so that there is a BCA. Having said that, there's an advanced body composition analysis have been installed in Kolors 2.0 branches. So you please need to visit, to know your body metabolic rate. How many sessions of glutathione IV is needed to see visible changes? So I don't know. So when you're talking about the glutathione, you are talking about the weight loss perspective, or you're talking about, the color improvement perspective. So I'm not aware of it. So I need to have a proper clarity on this. Before, answering your question, there is a glutathione, which is absolutely an antioxidant, and it is actually made up from amino acids, glutamine, cysteine, and then glycine. And this antioxidants depends upon your age and height. So we calculate, this is whether you're looking for an intravenous or whether you're looking for an oral medication. Since this is an antioxidant, first and foremost thing, there's no side effects. And second thing is, again, having said that, minimum at least from 8 sessions to 12 sessions and then 15 sessions. Initially we start weekly once, and then again after that again we give once in fortnight, once in 15 days, or after some time again we give monthly one shot also. So depends upon because in glutathione there are many XYZ products, and depends upon the age criteria, and depends upon your body metabolic rate, depends upon your weight also. The glutathione medicine, how much has to be given, is calculated and in a very calibrated way. And the most importantly, if you're looking for it in weight loss perspective, 6 to 8 sessions is enough, because the liver detoxification will happen due to glutathione. Having said that, this is something a proper antioxidant, so there's no harm to our body and there is no harm to our health, so don't worry about it. Weight loss and tight tummy area, upstairs arms area, yes, because most of the people are using canabolic steroids, right? And everybody, right from skin to weight, everybody is victims of steroid abuse. So when they go to gym, they do take a lot of pills and then a lot of powders, and then nowadays most of the people are into some kind of protein shakes, and then so the many things, again without physician's consent they're using. So fat is being accumulating in different parts of the body. If they're lean also, they'll be having abnormal arms, abnormal thighs, and most importantly cellulite, which is accumulates in the hips area and thighs area. So those, that is called as a spot reduction, that is also can be treated. Can saggish skin also become infected? Absolutely no. This is one of my favorite questions. Thank you asking Mr. or Mrs. Hundal. I'm not, I don't know, by name somebody Hundal asked me. Yes, this is something like, the sagging, something that is also can be taken care. Most importantly, those are obese, all of a sudden with the crash diets and all, when they lose weight, the body will be having a lot of laxity and sagging. We do have treatments, for which, where we use again, like, the tightening toning procedures. Again, cryolipolysis and then Evolvex and stimulations, high intensity focused ultrasounds, one of the best therapies, for the laxity, sagging skin. Are whey proteins healthy? Whey proteins are healthy, but remember, protein also has to be taken in a very calibrated way. The more protein, if you are not doing enough exercise, as per your protein intake, even the protein can be converted to fat, and the liver accumulates all that extra fat cells into the liver. So make sure whether it is a whey protein, whether it is a plant protein, whether it is an animal based protein, anything, it has to be taken in a calibrated way. But again, nothing be successful over the night. Something in a longevity perspective, think about it in a long-term solution, not just a short-term solution. So I think, I'm done with most of the questions. Veena Jeremiah. Thank you, ma'am. Very informative. And thank you so much, Veena Jeremiah. Thank you asking me questions. How can I connect? Yes, Kolors has a customer care support, and you just Google it, and then you'll get a Kolors customer care number, and then once you connect, you'll be getting a call back from our call center executive. So they'll give you the information whatever you're looking for. So today is live is seemingly very interesting, because I'm sure, I hope I have clarified most of your questions and then doubts, and yeah, you guys should prioritize your health. Health is very, very important. In a fast paced generation, one should give priority to health. So invest in your health. So that is a wise decision, one should make it. Mrs. Samina Khanum, how long we can maintain our weight once we lose weight in Kolors? Again, in my beginning of the live, I have mentioned today's live is all about, in a longevity perspective, how to maintain the weight in a long term. So Kolors is all about not looking for short-term weight loss solution. Kolors is actually giving a customized weight loss plan, and also to maintain the weight in a long term. So we are also having an options how to maintain the weight in a longer term, and even post Kolors treatment. Once the Kolors treatment, they're done with the Kolors treatment, they're lost around some 20-30 kgs of weight in span of 5 to 6 months. Even post that also, we ensure they'll not bounce back their weight, and again in a very calibrated way, in a very systematical way, without disturbing their present lifestyle, without putting any kind of efforts doing some kind of crash diets or starvation diets or mindless workouts. So because that is what all about the muscle. So when muscle is protected, when you're having a very good amount of muscle, so usually whatever we consume, whatever we eat, that will be converted into energy, that will not be converted into fat. So in colors treatments, where we ensure the more fat loss will happen, 2-3 times more than that, we increase their muscle. So as long as your muscle is intact, as long as you have good amount of muscle, so usually people will not bounce back their weight. Thank you guys. Now before wrapping up this slide, I would like to leave you all with one strong message. So what is that message? So most of the people they think I'll only tell you all how to maintain the weight, and then how weight loss is important in one's life. So it is not that. So usually in a longer time, when your body is going to last longer than your job, it is not just your luxurious things your designer handbags or your designer cars or expensive home, because invest in your health. So how to invest and how to take care of your health, how to take care of your the weight in your control is, see, most of the people think being fit, it is very short term solution. No, being fit in a long term is very, very important, because having said that, obesity is mother of all diseases. It is not just heart and the cancers. So because obesity is intra-related with all other medical complications in our body, so there is no way to shortcut health without your body paying the price. And it's weight loss something, the harder you push the fat, the harder your body resists. So one should not do any kind of calorie deficit diet, one should not do any kind of starvation diets or vigorous activities. Approach and then method is very, very important to lose weight. That approach will be taken care by the Kolors Healthcare. So your body is going to last almost longer than any job, right from your gadgets. For example, you invest on a gadget, so what will happen, that obsolete by next year's model, right? And for example, something you invest in your body is like your home, that you cannot sell or trade or upgrade. So when your metabolism is broken, nothing else matters. So invest in your health, invest the wisely. So fitness is everything in this fast paced generation. Investing in health, investing in your wellness treatments is very, very, very important. So this is what my message to you all for the day. Even most of the people when we talk about treatments and all, so they do have some XYZ excuses, but that excuses should not be at the cost of your own health. So when we buy a handbag, that will be out of style in 2 years, right? For example, when you buy a car, depreciate the second you drove it off the lot, right? So there are many things. But when you're investing in your body is something where you stuck with it till the time, the very end. Until the very end, you're stuck with your body. So invest in your body, invest in your health. So the health and wellness is very, very important in today's world. So that's all about it. And thank you so much, guys. And I'll see you in the next video. Until then, bye-bye and have a great weekend. Take care.